So Health Europe, we've got hot takes. We've got Antoine from Withings. So Antoine.
Prevention is something that everyone is talking about, especially in my home country in France, but no one is really acting for it. So we have to work with partners, private ones, to show for and to the system what we can bring to them before it scales to everyone. And for instance, a very good example we have done with a health insurer in France. They understand the data and the value of prevention and how it can help them to provide better care to their members over time, and also financially how they can save costs about this. So they have created, and I think maybe it's a very unique thing in France, but they have created a solution where for €1 per year, you have one Withings products, a digital prevention program, and nurses that are proactively checking the alerts and reaching out to the patients or consumers if the trends are not going the right way. And then they are redirecting the people to the right places. And when you think about it, for €1 per year, I think that's very unique. But they find the interest in this because it's educating people who are living in an healthy life.
Yeah.
So yeah, I'm very proud of this.
So that sounds awesome. One thing I think about, especially with the podcast, we think about underserved communities. And, a lot of people might look at wearable technologies and these great technologies that are out there as something that's mainly for people who are kind of on the richer side of society. Yep. But all the kind of interventions for prevention, the biggest upside, if we can achieve those interventions in people who need it the most, i.e. vulnerable communities, who don't often have the means to get these variables and these wonderful interventions that help with their behavior and motivation. Do you have any experience either in the work that you're doing in the US or with rural places or other healthcare deserts around the world?
It's true. I mean, we are in a capitalistic world, and so all the innovation are acquired by the upper class first. So that's the way the world. However, a very good example maybe in the US is the new access program. Now CMS is going to offer for free tools for elderly people to take care of themselves and to avoid risk of cardiovascular diseases. And so we are a partner in this. We are a participant in the list. I think we are the only European company doing it actually. And so we are going to help elderly people in the US that are under the public insurance, and most of the time it's quite difficult at some point to finance more private care in the US. So we are going to work with CMS to find the right ways to equip the patients that need it and how we can educate along time. So that's a very interesting thing we are doing.